Hello and welcome to a presentation in regards to transcranial direct current stimulation. I'm Naeem and I'll be taking you through an intervention specifically for major depressive disorder. In the contents, we're just going to have a brief look through on some of the contents of the presentation. Firstly, we'll be looking through major depressive disorder, what it is and how it's diagnosed, and some of the common symptoms that we will see during clinical diagnosis, and or not to mention some of the limitations that can be seen during clinical interventions. The second part will be looking at the procedure for transcranial direct current stimulation, the safety and the effectiveness of the actual transcranial direct current stimulation, and of course the limitation of what the TDCS has. And finally, we'll be looking at how the application of transcranial direct current stimulation is towards the major depressive disorder, looking through the suitability of the procedure and going through to measuring and seeing if this is an effective procedure specifically for depressive disorders. And finally, looking at the limitation of the research and the procedure in itself. Major depressive disorder, what is it? In the DSM, it is set to be diagnosed based on a patient that shows depressed moods for most of the day, nearly every day, or persists the low mood for up to about 2 weeks or more. This may include loss of interest or in pleasurable activities for the individual in itself. The symptoms can vary from individual. The common symptoms are insomnia, disinterest in engaging in social activities, constant fatigue or loss of energy every day, feelings of worthlessness, of excessive feelings of worthlessness or excessive feelings of guilt, and in some cases idealization of suicide or even attempt of suicide. Underlying causes that lead to major depressive disorders are after an individual has experienced severe trauma or perhaps a genetic disposition, and in some cases this could even be drug induced. There has been several studies showing that clinical and some non-clinical interventions of major depressive disorders, which can be the common ones can be prescribed in the medications, antidepressant, or commonly also known as cognitive behavioral therapy. Now, the main limitations to these research, first of all, if we look at medications, we have the common side effects, which can be experienced by individuals, and how the side effects can be overcome through further research within the medication. And this is something that we want to look at through further research, and something in terms of limitation that hasn't been quite looked at in how to reduce the side effects in itself. So looking at the actual procedure of the transcranial direct current stimulation, so what we have is the anode and the cathode charges that are placed directly onto the forehead and the temporal section of the individual's head. And what happens is the current goes through the subcutaneous tissue, through where the skull charges are applied, the anode being the positively charged and cathode being the negatively charged. The procedure has been shown to be safe with minimal risk and the benefit of being non-invasive. Risk is more likely to be minimal due to the low current that is used to stimulate the activity in the hippocampus and the prefrontal cortex of the brain. Effectiveness of the transcranial current direct stimulation can be measured through electroencephalography. This procedure allows the assessment of the individual's neurophysiological activity before and after transcranial direct current stimulation. Majority of the research in the TDCS process are in period of 3 to 6 months that were commonly used in association with major depressive disorder. While this period may be of a good length of time, we often don't know or have the quantity of the research process to suggest if this process can be effective and long-lasting even when the patient is not receiving treatment. Within the research capacity of a general TDCS, there seems to be research that lacking the ability to have large number of control groups and randomized trials or sample size. Large number of sample sizes will allow further enhancements of the quality of the research. Another issue that is quite prominent within the limitations of the general research in regards to the transcranial direct current stimulation. Is it an appropriate intervention for clinical practices? Well, transcranial direct current stimulation is an alternative treatment option to medications or even cognitive behavioral therapy. The appropriateness of the treatment will be based on the advices of the appropriate professional that is treating the patient at that time. Due to the low risk and minimal side effects in comparison to medication, this may be preferred avenue, especially if the patient have shown sign of resistance to other treatments previously. Research has also shown that the effect of TDCS can cause changes in the cognitive function through neuroplasticity. This can occur by stimulant of the current creating changes in the hippocampus, prefrontal cortex, thalamus, and amygdala. By allowing more grey matter to be distributed in these areas, this allows increase of functionality in these particular areas through, again, neuroplasticity. As previously seen in brain of an individual who has been diagnosed with major depressive disorder, which is in comparison to be a much smaller shrunk size of these specific areas. Possible improvement in research. Perhaps what could be done to improve these researches. More in-depth understanding of the process, more longitudinal studies. So instead of the 3 to 6 months that we have looked at, or the things that we have talked about so far, perhaps an increased amount of a longitudinal study. So perhaps going beyond the 6-month stage, or going even up to 12 months, or even up to 2 years. And then the study is not necessarily looking at the continuous treatment, but to see and follow up with the participant of each of the study groups and the participant of each study is to find whether the treatment is actually working even after further after the treatment in itself. So thus it comes down to the feedback of the individual in itself, whether this treatment is working even after a year since the study had been concluded from the studies. We could also perhaps even look at the choices the individual makes throughout the research, whether the individual gets enough sleep, whether the individual makes what type of lifestyle choices the individual is making, and of course the direct environment in terms of their relationship with family and the intimate partners, and if that also had an effect on the prolonged effect of the major depressive disorder, even while they were going through treatment of the transcranial direct stimulation itself. So yeah, I feel it's quite important that we could look more into getting some more feedback with the individual that was the participant of the study to get a more in-depth understanding of how effective this treatment is in itself.